Hello, my name is Laura Martinez, and my article was titled Speech Outcomes of a Prolonged Speech Treatment for Stuttering. The purpose of the article was to observe the outcome of an intensive, prolonged speech treatment on the elimination of stuttering in the long term. They tested how effective their current treatment programs were in eliminating stuttering in the long term. So they looked at how they could use protocols to measure speech performance and to assure that their treatments were effective again on the elimination of stuttering in the long term. And they did that by using their own treatment programs and observing how they could use speech performance measures to make sure that their treatments were actually effective. So the rationale behind the article was that the experimenters noticed that there was a problem of unnatural sounding speech after treatment. Every study reviewed by Onslow and Ingham showed that after treatment, clients were either perceptually distinguishable from normal speakers or they were judged to sound unnatural. So they decided they needed a naturalness data measured in their outcome data too. So they noticed that after speech treatments, a lot of the clients either had a very slow speech rate due to their attempts at reducing their stuttering, or they just sounded very unnatural. So they decided to include that in their data to make sure that their treatments were not only effective in eliminating stuttering, but also effective in allowing the clients to speak at a normal rate. So the speech outcome measures that they use in their protocols were percent syllables stuttered, syllables per minute, and speech naturalness. So the method that they used was they got 32 subjects initially in the experiment, but then it was reduced to only 12 subjects by the end when they got the results because they had a lot of complications with some of the clients and subjects not being able to progress with the stage 2 self-evaluations, or a lot of them just decided that the program wasn't for them. So the study consisted of assessing the effects of the transfer phase, the self-evaluation stage 1, the self-evaluation stage 2, and the maintenance phase that it had on the clients. There was a pre-treatment and a post-treatment assessments too. The speech measures were obtained from 6 10-minute audio tapes of subjects during conversational speech. So they were initially in the transfer phase, which consisted of the self-evaluation stage 1 and then the self-evaluation stage 2, where in each of the stages, the clients had to assess that they were meeting the targets for the intensive prolonged speech programs that they were in, and to assure that they were correctly following how the treatment was supposed to go. So there were in clinic assessments, which were based on 3 recordings of clients at each assessment occasion, such as speaking to a program clinician, speaking on the phone, and speaking to a stranger. Those were the in clinic assessments, and the beyond clinic assessments were based on 3 recordings of clients at each assessment occasion, such as talking to a friend, talking to a family member, and talking on the phone. A lot of these assessments were also made so that the client wasn't aware that they were actually being assessed, so that they can correctly evaluate how much their stuttering was affecting them, or if they were only trying to reduce their stuttering for the treatment in front of the clinicians. The conclusion of the maintenance program was approximately 3 years after the conclusion of the second evaluation phase. So during that time, a lot of them would be in the would be going periodically to the clinic to get an evaluation or get treatments from the program. And it tested the reliability of the measures with an independent clinician who was instructed to get the percentage of the stuttering severity, the speech per minute, and the naturalness scores in an identical manner to the experimenter who gathered the data originally. And a procedure was designed to ensure that the independent clinician's percentage of speech uh, of stuttering severity and the speech per minute measure showed adequate intrajudge reliability. So they had to make sure that the experimenter wasn't being biased and seeing a reduction of speech stuttering severity by getting a clinician who was independent to the study and didn't know anything about it to also look at their stuttering and see if they've improved. The results indicated that there was generally a clinically significant reduction in the percentage of speech stuttering. The rate of speech did not slow down and become unnatural with the reduction of stuttering. There was a significant elimination of stuttering that was observed in the everyday assessments and varied measurements, even in the long term, using their prolonged speech treatment methods. In the everyday speaking situations that the clients were put in, and for clinically significant periods, clients did not use a more exaggerated speech pattern than the one they were using at the time of their discharge from the residential component of the treatment. So they looked at the results of the prolonged speech program and they assessed that for the clients who the prolonged speech program did work on, that there was a significant reduction of their stuttering by using the protocols they used to evaluate their speech performance. So they looked at the speech stuttering percentage, the rate of speech, and then the naturalness scores, and they were able to assess that their stuttering did eliminate itself. However, this clearly is not a suitable approach for every client who stutters because the intensive prolonged speech treatment format was found unsuitable for 6 clients who were subsequently treated with other methods. So there were a few clients at the end of the results of the 12 subjects who ended up only lasting, who were unable to follow through with the speech programs, or from the results of the percentage of speech stuttering, the rate of speech, and the naturalness score, they were able to observe that their stuttering either increased or they just did not follow through completely with the program. So because of their protocols that they used to evaluate the speech performance, they were able to assess that the program did not work for them, and they were instead instructed to follow a different one that worked for them better. Speech measures were able to assess the effects that the treatment had on these subjects and indicated that this treatment was not working for them. So basically, the whole study just focused on these speech protocols that they suggest that many treatment programs should be following to assess if they're really eliminating stuttering in the long term. And making sure that they also look at naturalness in their speech rather than just eliminating stuttering overall. And they found that while it didn't work for everyone, their speech program, they were able to assess that having speech protocols did help the client overall because they were able to assess whether they needed that specific speech program, prolonged speech program, or if they needed something else. And that is the end of my presentation. Thank you.